Hello everyone, welcome to Metro News, Lifeline of your city. Myself, Disha. While all of India must protect itself from the viruses, the pattern of some states being far more affected than others raises questions about the possible reason for the predilection, which appears to be a feature of both the waves in India. Maharashtra has an unenviable position at the top of the leaderboard, while Tamil Nadu, Karnataka, Gujarat, Kerala, and Punjab features fairly regularly as contributes to rising number of new cases. Other states such as Chhattisgarh too are reporting rising numbers with high case fatality rates. Around 80-90% of the new infections reported in recent days came from the 8 states. The central government has dispatched teams to Maharashtra, Punjab and Chhattisgarh to evaluate the situation. Why is Maharashtra getting much infections even as other states with election and large religious gathering appear to be less affected? While the contributory causes of the high rates of the infection need evidence-informed elections based on extensive data analysis, several possible reasons can be listed as hypotheses. There may be some factors we have not yet recognized, but there are other factors which we can't list even now. Maharashtra is among the most urbanized and industrial parts of India. 5 among India's top 20 populated cities are in Maharashtra. They are Mumbai, Pune, Nagpur, Thane and Pimpri-Chinchwad. Mumbai leads the national list and has high crowded density in its large slums and low-income housing colonies. It also has a very high number of international and domestic travelers arriving by air, rail, road and ship. Its local train network, which forms the lifeline of the city, transport huge number each day. Any foreign viruses or its variant is most likely to land in India at the Mumbai airport and spread from there across the city and the surrounding districts. States which have higher proportion of rural population have low rates of transmission and low number of severely ill cases. This is because rural residents not only have crowded density but also live in more ventilated houses and work in open fields. They also have lower levels of comorbidities like hypertension, diabetes, heart diseases, and obesity than urban dwellers. Air pollution levels are too low. Even if they get infected, they are more likely to be asymptomatic or mildly affected. This pattern is not unique to India. African countries and even our Southern Asian neighbors too display the same pattern of lower infections rate and milder cases in their rural regions. Rural regions compared to big cities even after adjusting for differences in population sizes. Other factors to contribute to variance in the case count. There are questions to be asked before we compare the number of diagnosed cases. What is the testing rate in terms of tests per million population? What is the test positive rate after adjusting for the test per million? If too few tests are performed, the overall number of cases detected will be low, even if the test positive rate is high. It is also important to access the ratio of nucleic acid tests to rapid antigen tests in each state, as the latter has more false negative test results than the latter. Testing rates also tend to be lower in rural areas than in urban areas. The rates of transmission also depend on how well public health advisories are followed with respect to mass physical distancing and avoiding crowds. Now the question is how to fight the virus. The response has to be to battle the virus where it is most active while protecting other parts of the country from its spread. India is too large a country to have one-size-fits-all strategy. Localized lockdown to isolate hotspots in cities may help, but there has to be absolute commitment to masks in public and avoiding crowded events for several months more. Simultaneously, vaccination must be speeded up. Even when transmission rates fall as a result of these threatened restrictions, discipline must be maintained without rushing to celebrity illusion, herd immunity, and abandoning protective public health practices. In parts of India which are presently less affected, restrictions can be less threatened, but general public health discipline must be maintained. The virus will love to crash celebrations and race to the rallies.